Hello. Can you guys hear?
We can hear you, Senator.
All right. I'm sorry. Representative Felipe, can you take the lead on this? I'm in the middle of doing something else. Can you take the lead? I'll be back in like 15
Yeah, you got it.
All right.
All right. We're just waiting for Senator McCrory, but I'm glad he's here and glad to have you guys here. Madam Administrator is in front of us. And Senator, you're unmuted.
So, Mr. Chairman, we have the Teachers Retirement Board team ready to go.
Awesome. You guys may proceed. Let us know what's in your budget. What are we talking about today?
Ellen, you're up. Uh-oh.
Can you guys not hear us?
Rob, is Helen frozen? Helen, can you hear us?
I can hear you.
Oh, I'm glad Rob can hear us.
Let me pop over, see what's going on.
Okay. Oh.
Never a dull moment.
Never.
All right, I'll log out and log back in. Hold on.
Oh, we can hear you,
We can
Helen.
hear you.
I'll give it a.
Oh, I guess she can't hear us.
Yeah, she's gonna log out and log in. Sometimes it like defaults to your headset, not your headset, so I think that might be the issue. So
Thanks, Bob. I appreciate that.
no problem.
I gotta say, Madam Administrator, as nice as your background usually is, it's nice to see your face.
Oh, thank you. Helen, can you hear us?
Can you hear me now?
We can. Can you hear us? Oh boy. Helen?
Frozen again. Oh no, it's not frozen.
She's not frozen. We can hear her. She can't hear us.
Can you hear me now?
We can hear you.
Okay.
Can you hear us?
Yeah. I had it on speaker. I just did it again and I don't know why. Now it's working.
All
Okay,
right.
Helen.
I clicked off headphones. I'm like, why isn't this working? So I did it again. So it worked. Sorry about that.
All right, well, welcome, and the floor is yours. Let us know what we're getting into today.
Okay. Did you have questions about the information we sent over?
I personally didn't. I don't know if members did, but we were hoping you give us a little overview, and then we would get it right into questions.
Yeah, Representative Felipe,
Sure.
I didn't see, just going off of information I've heard before, I think it might be worthwhile if we just heard a little more about what the teachers are paying now into their health plan with that new, or it's not that new, but the Advantage plan. I think there's been some discussion. There may be some problems with that. Can you just give us some clarification on that piece of the?
Oh, sure.
Yeah.
Of course. And there's no issues. The plan's been running better than it's ever been managed before. We are down to maybe 3 to 5 calls out of 32,000 members, and we have an escalated team. For January 1st, when we combined the Medicare Advantage with prescription drug into the MAPD program, and we offered our members the Medicare supplement program with the same prescription drug benefit. We were able to increase our benefits. There was a lot more bells and whistles that members were able to get. we were able to combine the medical, vision, dental, the medical, vision, hearing, and prescription drug all under one umbrella with United Healthcare, one phone call, one customer service. We were able to negotiate great rates. The Medicare Advantage folks, they pay $83 a month, and that is for all of those services plus dental. There is no subsidy for the dental. The plans are bundled. So we have almost 28,000 members who pay $83 a month with a great employer group wrap plan. It's a national program. The senior supplement plan, we have about 4,500 members in there. When we went to the negotiating table, the RFP committee felt we could still offer that program to those few members because we'd offer it previously. That plan with everything is $326 a month. And that's because it's a Medicare supplement program, very different than a Medicare Advantage program. As you know, Medicare was developed in 1965 and the Medicare supplement plans are managed by the federal government. They are the ones who went to, Bill Clinton in 1997 started this whole process with Medicare Advantage programs. And then in 2006, Medicare Part D came into play to provide assistance for seniors with prescription drug coverage because it hadn't existed prior. So our members have a fabulous program, and they actually have the option to buy up to that Medicare supplement program. And based on the statutory guidelines, we have a base plan that the 1/3 is contributed to, and that 1/3 is contributed to both plans, the Medicare Advantage and the Medicare Sup. We thought it was a great service to allow those members to buy up. That is their personal preference. We do monthly Medicare open enrollment meetings. Everything is listed on our website. We communicate with retiree groups on a monthly basis. The state of Connecticut retirees do not have the option to have that plan. Our senior population every year during annual enrollment has the option to move into the Medicare Advantage program or select that buy-up program. We're very proud to offer that to our members, but the subsidy is based on the state of Connecticut base plan. And as you can see, 90% of our members are in those plans. Again, they are nationally carved out plans. Anyone on any of those plans can see any provider as long as they accept Medicare assignment. About 97% of the providers out there in the world accept Medicare assignment. There's no network for our members. We have an escalated team that we work with United Healthcare in case there are any issues. Again, the plans are running the best they've run since my arrival here in 2018. They are bundled, and they're bundled because, as you know, insurance, with the dental program in an effort to keep those rates viable for everybody, you can't have it be an option. You can't have people coming in and out of the dental plan because the plans are for the whole population. So they are bundled. So members must elect all of the programs. So right now, the medical, prescription drug, vision, hearing, they're all under United Healthcare. And then there's the Cigna dental that we offer, which is $50 a month. And again, there's no subsidy for the dental, but it is bundled. And it is bundled because that is how you manage health plans. You certainly, if we had 20,000 out of the 32,000 take that dental plan, the rates are going to be very different. So it's really based to offer everyone that program and to keep those rates viable for everyone.
And thank you. And that's good information to hear. I appreciate that. Do we expect a big increase in our retired teachers going forward? I know we've had a lot of retirement. I'm just wondering if you track what you think the projections are going to be going out.
The projections are all tracked. We don't expect any major increase during the life of this contract. Actually, our rates from 2021, I believe they went down. They were 127 for the Medicare Advantage, and they went down to 80 for 2022, and they're 83 for 2023. So by us getting rid of that self-funded standalone Part D employer group wrap plan and bundling it with the Medicare Advantage program, we were able to provide significant savings. I think it's $140 million over the life of the contract and continue to offer enhanced benefits for our members. Some of our members, that small population on the Medicare supplement program, again, we are not comparing apples to apples, they're apples to oranges. The Medicare Advantage plans are managed by the carriers. They follow all Medicare rules and guidelines. They must cover everything Medicare Part A and Part B cover, and they offer enhanced benefits to try and keep the population healthy. For example, we have like a life alert system. There are non-Medicare benefits that they're able to cover as well. There's diabetic programs, there's home visit programs because it's a Medicare Advantage program. With that traditional Medicare supplement program, it follows federal guidelines, and the federal government doesn't offer those programs. I can share with you that if we went on to the State Department of Insurance and looked up, individual rates for Medicare supplement programs, just a Medicare supplement program, there's bar to none what offers our retired teachers. Some of those standalone Medicare supplement programs that are comparable to just our Medicare supplement program range from $400 to $800 a month. Our program that we offer for $326 a month, and which includes the hearing, the vision, and hearing, vision, and prescription drug, again, which are carved out plans for our 32,000 retirees who live nationally throughout the U.S., are not available to regular individual Medicare recipients in the public marketplace.
Okay. Thank you for that information, Helen. Thank you.
You can cut me off anytime, but McCarthy, I just love to talk.
No,
so
just
feel free.
the more we learn, it's very, it sounds like it's managed very well, and I appreciate getting all that information. Thank you.
Of course.
All set, Representative? All right. I noticed that in the materials you sent back, the question, some of the questions that we had were sent just as questions. There weren't actually answers attached to them. Specifically, the question on the makeup of the board, racially, ethnically, and also in terms of gender. So I wondered if that answers to that.
We have that in there.
Yeah, there's a chart in there that breaks it all out for you.
Yeah, it's on the bottom of the Excel sheet that we attached.
You'll see there's
Okay.
there's
I
14.
just saw the Microsoft Word document with the questions in it. I didn't know they were answered in the spreadsheet.
There should have been two, Rep. Felipe. There should have been an Excel file and then a Word doc.
That's okay. We have it all in front of us anyway. So you can, I'll just say, so we have 14 board members. There's only 13 of those positions are filled right now, 8 of which are male, 5 of which are female, and 12 of which are Caucasian, and then 1 of which is non. We don't come up with the board members. So every 4-year cycles, there are people that are elected to the board if there's more than one open board position, and the rest of them are government appointed or ex officios from the government. So we, as the administrator of the plan, don't really have a say in who's on the board and not on the board. But happy to answer any questions that you have about that.
Yeah, that's understood, and I don't want anybody to take this as throwing blame at the situation as it is, but I just feel that it is wholly unacceptable that it's a 12-to-1 on there. I don't care if it's majority Caucasian, but it seems like it almost seems like there's a token member of the board, or the fact that it's actually more male than female was interesting to me as well. Because you talk about how some of them are ex officios, but you think of the amount of teachers that we have.
Well, Representative Felipe, I know that there's been a lot of work that the government's done. Teachers in the field are Caucasian. I believe there's 7.3% who are of color. I'm happy to share some information that CEA has printed out and some research that the governor's done to try and break those barriers. So that could explain why there's this particular model for the board, because in the industry there is not a lot of diversity. I just saw a special last week. And I'm happy to forward some of the articles that I've just read on my own.
Yeah, regardless of that, and I do appreciate what those statistics mean. However, the student population is made up a lot differently.
Oh, absolutely,
And,
100%.
This is only 14 of such folks, and as you said, some of them are ex officio, and one of them is missing, right? So that doesn't mean that the pool that we have to work from has to be particularly from what you said is 7.5%. What I'm saying is that it should just be more reflective of the student body rather than the teacher workforce, just because I understand what we're looking out for. However, those voices aren't represented at all. And if you don't find yourself represented in a certain place, what makes you aspire to be a part of that? So I'm not saying that the statistics don't say what they say. I'm saying that the only way to change that is to show that in leadership or in places like this, which I see this as a place of leadership, at least, when it comes to teachers who are aspiring to stay long enough to retire and be a part of the system. It needs to look a little bit differently. So I'm not blaming anybody. I just wanted to have those numbers so we can continue to have these conversations around equity. But it is not encouraging in terms of racial and ethnic breakdowns, but in terms of male female, it's interesting that it's 8-5. Obviously more parity there. The other way might actually be better, but I digress. It's pretty split that way. So it's definitely something to talk further about. Any other questions from members of the committee?
Sorry for joining late, Rep. Felipe. Are we on TRS still?
Yeah.
Yeah.
Okay. I think I have a question, but I'm kind of catching up behind the 8 ball, if that's okay.
Yeah, that's fine. Take your time.
I'm just wondering, the questions that I sent over, the positions there, you're saying you have 3 open positions right now, correct?
Correct.
All right, and do you have them in the budget as full-time, full-year resources starting the July 1st?
Yes.
We are thrilled that these positions made it into the 2024-2025 budget. So we're very excited.
What are the odds you're going to have them filled? It looks like last year you had 4 vacancies and you have 3 now, so.
Yes, we weren't funded for them. We were funded for 24-25. So we'll start to fill those in the first quarter of July of the budget year.
So you'll start to fill them first quarter.
Mhm.
So they won't be here 7/1.
We can't fill them until 7. We can't officially fill them until 7/1, but we can start our recruitment process probably in May. We'll start staggering them. And hopefully we'll have a pool of candidates. Has been rather tough in this market. There a few years ago, Revenue Share, we had, I think, 265 people apply for a retirement benefit officer training position. And when we were looking for a retirement examiner recently, we barely had 20 applicants. So it's really changed. And of those applicants, the pool was very different than we've had in the past. So cross your fingers, and we're looking to be very positive to get those positions filled.
Okay, and for lapses, do you have lapse dollars as of 6/30?
As of 6/30/2022?
This last 6/30, yes.
Yes.
Well,
yes.
no, yes, from that, and do you propose having any this year? So you do from last year.
Yep. Last year we do.
And
There
what
was-
were those?
There, in by category or in total?
Let's start with total.
Okay, in total, there was 2 million out of our 1.5 billion budget. So about 1%.
Mm-hmm. And maybe if it's easier, you can send me the classifications, the breakdown of what that 2 million encompassed.
Yep,
And
absolutely.
Are you projecting lapses for this year?
Yes, about right now we're at about 925,000 out of a $1.6 billion budget. So less than 1/2%.
Okay, and if you could send what you're projecting for this year also, I
Yes,
would appreciate that.
Yep. not a problem.
And I think that's it for me. Thank you.
Thank you, Representative. Anybody else?
While we have the experts here, could someone just give me a little information? I see it in some of the responses, but just about receiving credit time for other retirement systems. How does that work? How does that function? And do we have many of those?
I guess I'm not sure of the question.
Yeah, the question is, do we give credit to our retirees for retirement credit that they may have received somewhere other than what we're doing, like Social Security? I know they don't receive Social Security, but are there any other retirement benefits that they're credited with at all?
Do you mean like if a teacher taught in Massachusetts and then
Right.
moved to Connecticut? Yeah, they
Yes.
have the ability
Yes.
to purchase,
Mhm.
they have the ability to purchase that service time, yes.
Okay, and do we have any idea how many that may be? And the only reason I'm asking is going forward, we're looking at a lot of reciprocity agreements. We have such a teacher shortage, so eventually that will catch up. And I'm just curious that those credits will be portable. So I think you answered that.
Yes,
The
there's,
answer is yes.
yes, Rep McCarthy, there's a slew of different service credit that teachers can purchase while they're active. Once they retire, they can't purchase. But, for example, as Bob was saying, if someone taught in New York for a few years, they can absolutely use that to purchase. It counts as outside credit service. There is, you can purchase service for, if you taught in adult ed in a classroom. There's a whole multitude on our website of various programs. There's military time that you can purchase, non-war, and then peacetime. So there's a multitude of different ways that service purchase can be purchased from other systems into the system. As long as that member does it, they meet the criteria that they were certified, et cetera. There's a few rules that go along with that, so to make sure that our plan stays qualified. And they can do all of that before they retire. Once they retire and start collecting a benefit, you can't purchase other credit. They can also roll over funds from various programs as well. In 2022, we modified one of our rollover programs, and teachers now can roll over qualified pre-tax funds up to 2 months before they retired from a 403B or another qualified program into that annuity, which is a lifetime annuity at 6.9%. They also have their post-tax voluntary contributions that they can contribute through payroll deduction up to the 415C limits, and they can roll those over into a lifetime annuity as well. So there's a lot of options for our teachers to utilize various programs, not only rolling money into annuities, and also to purchase service credit.
And then I guess I'll add one thing, we do have certain safeguards and constraints. So let's just say, the Connecticut's teachers' retirements is pretty healthy, right? So if you worked 25 years in Georgia and then you moved to Connecticut and you did 2 years of teaching here, you can't purchase your 25 years of service in Georgia and then come retire as a Connecticut teacher. There's, I think it's 1/2 up to, I think it's like 10 is the maximum out of state service you could purchase to go towards your retirement here in Connecticut. So there are some safeguards to protect the system from that extreme situation where you do all your teaching in somewhere that doesn't have a great retirement system, and then you want this retirement system, then you come back here for a year, you can't purchase all that time from out of state. So.
Wow. Thank you for that extra clarification. Yeah, it's a lot to learn with the TRB, actually. So thank you.
Thank you. Now, are there any more questions? Well, if not, we thank you guys for being here. And I want to say, just for members of the public who might be watching, the less questions we ask usually means that the system is working. So you can take that with you, and we're glad to have you. Thank you.
You bet. Thank you,
Thank you.
everyone. Feel free to email us with any questions you have. Thank you very much. Have a great day.
Bye-bye.
All right.
So, Mr. Chair, Commissioner Bai is here, and I see several members of her team have joined her.
Awesome.
So, Commissioner, do you have all the folks on that you need, or should we give?
Yeah,
them a
I'm good.
minute or
I'm
two?
good if you're ready to get going. Sure.
Okay. I like
Absolutely.
the look. I have not seen the headphone look, so I like.
I
the-
know I'm having trouble with the mic on my computer.
Well, I
Not
like.
my preferred look.
Well, it looks like we get to start early, which is exciting. So thank you for being here. And if you want to give us a quick overview before we ask questions, we'd enjoy it.
Sure. Well, first, hi, I'm Beth. I'm the Commissioner of the Office of Early Childhood. Happy to be here. I just want to let you know who's here with me from my staff. So if my team could turn on your cameras just while I introduce you. I have Deb Fliss, who is both our incident commander, who was so helpful during COVID, and oversees our quality improvement efforts, working closely with early childhood ed as well. Maggie Adair, who's our policy and communications lead. Nicole Cosette, who's here. She's a research analyst and is here in her capacity with Birth to Three. Sarah Poulin, who is our fiscal director. Julie Giacone oversees both our CC Child Care Development Fund federal funds, but also has had the pleasure of overseeing the hundreds of millions in American Rescue Plan funds and is making sure we have all those reporting requirements in place. I know Holly Williams is here. She is our analyst for OPM. And I think did I miss anyone, Maggie, who's from OEC?
No, you didn't miss anyone. I'm sure there'll be a few other staff that will
Okay.
be clocking right in at 1:30.
Okay, well, I'd ask the chairs, Representative Philippe and Senator McCrory. I do have the documents. I do have answers to all the questions you asked, and you know, it's really at your pleasure. I could walk you through those answers which we've provided, or we can take your questions. So you know, I leave it up to you to how you want to manage that.
I think in the past we have had you screen share your
Great.
answers, and then
Okay.
we went through them. I think that would probably be beneficial.
All right.
We'll do it very quickly. I don't need, we don't
Yeah.
need to go too deep into it. But if we go bucket by bucket, then when folks have their questions.
Okay.
try-
Can you see my screen?
Yes.
Okay.
And for members, if you have a question on any particular bucket that we're on, just make sure you're raising your hand so I can call you.
And I'll try to make it a little bigger for those of you my age on the committee. Okay. The first question was about our staffing. Our general fund count is 118. We have 80 general fund positions filled and 4 TWRs. We also have 37 federally funded positions. One of those is a TWR. We have 35 vacancies in our position count. And it's a little complicated because we don't have enough funding given the average salary to fill all 118. But we are working to fill them. We filled 7 positions since July. We have a number of active recruitments that we're working on. The second question is, you asked for what statutory language is needed for Birth to Three providers to be eligible for the COLA. We really think this is, in your purview. We are happy to work with you on this. And OPM can come to the table as well because they're the ones who interpreted the statutes to give us guidance about who would qualify for those. We have a lot of data on the increase in Care for Kids rates. I'm not going to read through this, but basically we have between 20 and 21,000 children on Care for Kids as of now. And the plan was to begin an enrollment management system to bring that down to 17,000, which is still 2,000 above what we had pre-pandemic. But that would include a reduction in the number of families served. So the governor has applied 35 million in temporary funds so that going from 20 to 21,000 children, we will only really be going down to about 19,000. I don't have the exact number, but 19,500. So that was the point of the governor applying the 35 million. And, I'm happy to stop here because the Care for Kids, I know there are a lot of questions, and sort of the best way to deal with this is just to take the questions as they come. So now we'll go from 20,600 down to 19,500 by December 2023. So right now, most of the families applying will continue to get on, especially the high need, depending on, their reason for coming on. But there will be some slowdown in the growth. Basically, the system has grown from 15,000 children to almost 21,000 children now since we applied the federal relief dollars, and we've just kept the program open. So this has never happened in the state before, where it just kept growing. So now, like most states, we have to do an enrollment management to keep it at about 19,500 by June.
Okay.
Do you want to stop there because
Well,
of Care for Kids having a lot
I
of
actually have a
questions?
specific Care for Kids question. It's not exactly a fiscal question, but
Sure.
on February 9th, there are a few parents within my district in Bridgeport who had received letters that Bridgeport public schools are no longer participating in Care for Kids. Is that a function of us, or is that them opting out? I'm not sure what it is.
I'm so glad you asked this question. I've been working with those families, representative, and I'm so glad they reached out to you. Bridgeport Public Schools, as any organization that receives Care for Kids, is subject to the federal rules around Care for Kids, which include background check, which include fingerprints. And OEC has been offering those for free during the pandemic. You'll recall it used to be $85 a staff member, and it will return to that when the pandemic funds run out. Also, it's subject to an inspection as a exempt program that receives Care for Kids. It's not as extensive as licensing, but there is an inspection. And when we went for the inspection, they were not in compliance with the background check. And they said, this is too much to keep up with. We're just not we're gonna opt out and not do Care for Kids anymore. Now, they did tell our office that, and we do try to make it as easy as possible to do background checks, but it's not easy. It's something people have to do if they work with kids in Connecticut, and it can be hard to keep track of as much as we do our best. So I did reach out to the school board chair representative, and she is talking with the superintendent. This impacts about 7 children. We were concerned it was many more. But what the Bridgeport schools did, rather than say, we're not going to collect Care for Kids and we'll just eat that cost for those 7 families, they sent those 7 families bills for tuition. And so bigger than the families could afford. So they were concerned. But we do have open school readiness spaces. We have 4 Smart Start spaces. So we're working to work with Bridgeport that if they don't change their minds and they continue to say we're going to charge parents tuition, we can place those families in other settings.
Yeah, we better.
We will.
I don't feel good at all
No, I don't
about
either.
charging those families tuition, regardless of how many families it is. That just
Exactly.
seems a little. In my view, it's just the wrong way to go about it. Representative or Chairwoman Walker, you have a question.
Yeah, thank you. Thank you, Chair, and thank you, Commissioner. So for the Care for Kids, right now, if I heard you correctly and read correctly, we have 20,000 kids right now registered. We have to drop down to 17,000. So we have to take 3,000 off of our roster. Is that correct?
That's not the plan, but that was the plan before the 35 million was added from the American Rescue Plan state funds that the governor added into his budget from the state fiscal relief dollars. So the plan is, rather than go to 17,000, go to 19,500. So rather than drop 3,500 spaces, we're going to drop 1,000 spaces by December, and then 2,000 spaces by June of 2024. So it's a slow reduction in spaces using enrollment management.
Okay, I'm sorry. You're gonna drop it from, say it to me again, because I.
Sure.
Uh-huh.
So without the 35 million, we
Right.
would be going down to from 20,600 to 17,000.
Right,
The governor assigned 35 million, which allows us another 18 months or longer to keep the numbers up between 18.5 and 19,500. There's still a drop, but it's 1,000. And there are times when they're natural drops. We've fluctuated between 18.5 and 21 this year. So that it is still a drop, but it's much different and it's a much slower slope. So most families, particularly in the high need in, TANF families, teen parents, and families making less than 50% of SMI will likely continue to be enrolled. It's the higher income and the workforce development that will have to wait on the enrollment management system to get in.
okay,
Those are
so,
the likely ones to be in the 1,000.
so when do we start redetermining people?
We
March 1st was.
March 1st, we started the enrollment management.
Right,
Redetermination, I'm so glad you asked about that. We redetermine everybody annually,
yep,
but nobody will lose services at redetermination.
okay,
And we have the benefit cliff built in so that if you were in because you made less than 50% of the state median income and you get a raise, you can stay in until 65% of the state median income. So that was that's something we fixed, Representative Walker, with your help a few years ago. So we now, it's still a cliff if you make over 65%, but this enrollment management system won't have anyone who's currently getting care for kids off. They stay in the system. This is for new families.
for new families, okay.
So that was an important question.
Yes, because I've gotten a lot of calls on that. So right now with what we've got, we're also increasing the Care for Kids payments, correct?
Yes. The
By-
proposal is 10% a year for both years.
So where does that bring us in comparison to what the feds want, which is a 75% of the market rate? So where are we with this?
It would really take probably like as our math looks, it would take a third year at a 12% increase to get to the 75%. And I explained at the first meeting that we have to be careful about huge jumps all at once because of the impact on families making more than $60,000 a year, because programs have to raise their rates to collect the increased Care for Kids. So I really believe, as much as I do believe early childhood educators need to make more money, we have to, and 10% is a significant increase. I've never seen a 10% increase 2 years in a row, but more than that could destabilize things a little bit for other families who aren't on Care for Kids and don't qualify.
Okay, does this jeopardize our standing with the federal government?
We were in jeopardy because we didn't have a plan to increase the rates. The governor's proposal of 10% a year for 2 years, and there will be a 30-year amount depending on negotiations with the union, does show the feds that we are on a path to increase the rates to get to 75% of the market rate.
What's our maintenance of effort requirement for CCDF?
I am going to call on,
Okay,
we have, I'll ask Sarah Poulin. It's on page, you'll find this on page 4 of our answers, but Sarah Poulin's really good at explaining this, our fiscal director.
okay.
Sarah.
Good afternoon.
Good afternoon.
Sarah Poulin. So our maintenance of effort for CCDF is $18,738,358 per grant year. We also have a matching amount. And this year, our matching amount is around 15 million. It's a percentage of the amount that they give to us in that federal award of the 16.8.
So the CCDF matching amount, I see it here. It says 16,808,000, and then for the CCDF mandatory, it's 18,738. Is that correct?
Correct. Well, we lined it up with those two SIDS. Sorry.
Yep.
Just because that's kind of like where they align.
Because the dots. I'm sorry.
Sorry, that's just where they align with
Just a
how our
second, just a
reporting
second. Senator McCory, could you mute yourself so that I could hear her, please? Thank you. Go ahead.
Muted him, Pam.
Thank you. Go ahead, Sarah.
I was just saying that we line them up on this grid because that's more or less where they align in our reporting for the feds. But it's kind of the entire program aligned. So, we have a discretionary account that's around 40 million. All three of those together, all three of the matching, mandatory, and discretionary amounts kind of all play together with the 18.7, and what's on here is the 16.8. So
that those matching we meet in our line items, so it does not jeopardize our federal funding at this moment.
Correct. Yeah.
Okay, I got a yes. Okay, I just want to make sure we're there. And so the 10% is going to go to infant and toddlers, preschool and school age, or
Yes. And family childcare.
and family childcare. Okay, so all four,
Yeah, everybody.
and all four are covered in the amount that you have in the sheets before us, correct?
Yes.
Okay. All right. Okay. All right. So we're just on on Care for Kids. So I have a couple other questions, but I'll wait until that comes around. Thank you.
Okay. Thank you. You're muted, Representative.
Thank you. Thank you, Madam Chair. And now we have the good ranking member of the Appropriations Committee.
Thank you, Rep. Felipe. So I'm trying to understand how this is working because you said something that I'm very concerned with looking at this. So the governor is proposing 10% rate hikes. And we're reducing the amount of kids that are actually going to be able to use this program as a stabilizing method. And the balance of this is going to fall back on everybody who cannot get this benefit, correct?
Well, I think it's important to look at a high level to say that the current system is not working. We're losing providers. We're paying 30 to 40% of the market rate. And that reduces capacity to serve families. And for the families that have the certificate, being able to go and say, I can give you 30 to 40% of the market rate if you'll take my kid, both makes it difficult for the provider and also difficult for the parent, because sometimes the parent has to pay the difference between the 30% of market rate plus what it costs, depending on the private provider's rules. So I would argue that without the hike in rates for Care for Kids, we will lose more childcare capacity because the programs are on the brink. So I think I just want to make that point. We also have been serving more than 4,000 more children a year because of some of the challenges of COVID. Before the COVID, we were serving about 15,500 kids, and now we're serving more than 20,000 kids. So that's a big jump. The governor proposes to continue that increase, serving more than before the pandemic, while stabilizing the field as much as this helps. It only helps some of the providers, less than 30% get Care for Kids, and even they are still taking less than 75% of the market rate. As Representative Walker pointed out, we're still not to 75%. So given where we are fiscally, I think The governor's assigning federal relief dollars to try to reduce that decline, and is saying we need to pay closer to the market rate. So I hear what you're saying. There will be fewer families than are served at this moment, but there's still significantly, with this budget over the next 12 months, there would still be more than 4,000 more families receiving care for kids than did in 2019, which certainly represents the biggest growth in caseload since I've been involved as an advocate in 30 years.
So I think we're kind of missing part of the point, though. Like, as you knock those 4,000 kids off, that puts them into the market that has to pay full price. And we've just inflated the cost of, this budget is going from, we're going from 59,000, say $60 million in this year to $113 million in 2 years. We're almost doubling it. And we're going to be doing less kids, and that's going to put more pressure on the market of the people who don't qualify for this, who are people who probably need it as bad as anybody else because they're working full time and trying to pay for childcare. So the snake's eating its tail here, right? It's just going to keep eating its tail, worse and worse. I don't quite understand what we're doing by throwing so much money into this program, reducing the amount of people who are going to qualify for it, and putting more pressure, you even just said, destabilizing the market for people who are not on Care for Kids. There's more people who are not on Care for Kids that are going to have to try to now assume a massive uptick here than there are people who are on the program. So I guess I'm really struggling with what this is doing in this massive increase from 60 million to $113 million in 2 years. And I'm just hoping there's something here that can explain that, or you can show me how this is good for 3.6 million people, because I'm really kind of struggling with this one.
Well, I did my best to explain before. I think it's critical increase in rates for providers so they can stay open, and access to significantly more families than had access before the ARPA funding. But you all.
But you just said you're reducing access by 4,000 people.
Well, what I was saying was we were serving 15,500 before we got the federal relief dollars. So we have significantly increased the number of families we're serving on Care for Kids under Governor Lamont.
But then we're cutting it down.
Well, like many things you're seeing, I'm sure, Representative, on this committee, these were meant for, as some funds were meant for one-time funding, and the governor decided to assign it to help families access childcare during a time that was difficult.
But ma'am, one-time funding is not increasing a budget by almost double in the general fund budget. That's not one-time funding. That's operating budget that is being paid for by all the taxpayers of the state. So well, I understand one-time funding. This isn't one-time funding.
No, that's what the governor's asking for, is an increase in the rates.
Okay, that's all I have for Care for Kids. I'll save my other questions for later. Thank you, Representative Felipe.
All right, Representative Paris, I saw you had your hand raised. Do you have a question?
Yes, Mr. Chair, but it can wait. It was more related to the reimbursement rate, not to Care for Kids.
All right, then Commissioner, if you wanted to continue
Sure.
With the questions, I think that's
Sure.
all we had for Care for Kids.
Okay. The next was to provide racial and demographic data for the parent cabinet. So I was going to call on Elena Trueworthy, who's been helping to oversee this for us. I do have the document. Do you want me to shift to that document, Elena, and you can speak to it?
Sure, that'd be helpful.
Okay.
So just for a little bit of background, the OEC Parent Cabinet was co-designed with a group of parent leaders throughout the pandemic, really, and we launched a little over a year ago, November in 2021. And so the terms of the current Parent Cabinet members is our 2-year terms. We have 15 members that represent all 6 regions of the state, 2 representatives from each region, plus 3 at-large members. And throughout this process, it was really important for us to think about having lived experiences and voices at the table that represented different groups, different perspectives, different experiences, et cetera. And so the end result is that we have, for gender identity, 13 females and 2 males. For race ethnicity, 8 Black African Americans, 2 Hispanic Latino, and 5 white Caucasian. We have over 5 languages spoken on the council, and also 8 families that have experience with OEC services and public benefits. And 11 out of the 15 members, have children ages 0 to 5 years old. So we have, we think, a good representation from across the state. But I think, and also a very important piece is that this is just one aspect of our larger family engagement strategy. So the role of the parent cabinet members is really to reach out into their communities, to speak with the other parent leaders and parents, and bring that feedback back up to the state level.
Thank you, Elena. And Elena serves as our deputy commissioner at OEC. And she and Shanae Russell got this off the ground for us with Lorna Thomas Farquharson. Any questions about that, or should I just? Yeah. Representative.
Is this considered the blue? I heard of the blue ribbon panel. Is this the blue ribbon panel?
No, no, this is the parent cabinet. Now, the blue ribbon panel will work with the parent cabinet. So the blue ribbon panel will be about 20 individuals from business, parents, education, the legislature, and advocacy groups and childcare providers who are going to spend the next 10 months coming up with a 5-year plan for childcare, given all the challenges the field faces that you all have been talking about.
Mm-hmm.
And those recommendations will be brought to the governor next December, but there'll probably be there will be about 6 public hearings throughout the process.
Mm-hmm.
There'll be 4 key topic areas. And we really see this as an important step to have a plan, because we've received a lot of programs because there are a lot of problems. And so we get programs from the legislature and the governor's programs, and then the feds send us programs. And we really feel like we need this sort of pause to think, how do these programs fit together? How can they make more sense? How can it be that one childcare program is reporting to 5 different parts of our agency about what they're doing instead of one approach? And how can we leverage the federal dollars better? And the governor's really intent on how do we bring business to the table, both with ideas, but also with resources to be a part of the solution.
Okay, so the panel that you just talked about, who chose these the memberships for this?
I did, working with the office of the governor. The legislature has the chairs and ranking members of education, are 4 of the 20 members. So they make up, a good part of the membership.
The education committee or the legislators that are on this?
The chairs of education is our oversight committee. So the chairs and ranking members of education.
Okay. And okay. Okay. And this blue ribbon is going to be appointed by, so you chose this group and the governor chose the blue ribbon panel.
Well, I didn't choose a parent group. The parents co-designed and parents interviewed and selected those members. And so they will be informing the process as well, but we did not pick them. I mean, there was an interview process. I guess, Elena, ultimately I approved the list of who the parents selected and was looking to make sure there was representation from regions and race and language. But other than that, it was selected by parents, leaders in each region.
Exactly.
Okay. I just, I believe that it's got to be balanced, and being balanced means that it's got to be chosen from people other than ourselves.
Totally.
Because we tend to look at it from one perspective, and by doing that, we end up losing the voices of those that can help us think outside the box. So I'm a bit concerned about the blue ribbon and this one, but I just want to ask that. Okay,
Yeah,
thank you.
well, I just want to reiterate, the parent cabinet was picked by parents. It wasn't picked by us. And
Right.
and there were a lot of the 2-gen parents who were a big part of helping us because of they had experience with that. And
Mhm.
then the early childhood cabinet will be informing the panel. That is not picked by us. That's laid out in statute by you all. So there will be a lot of public feedback and
What,
et cetera.
I'm sorry, which cabinet did you say that was picked by us?
The early childhood cabinet is in statute, and that's laid out in statute as to who will be represented on that. And that meets quarterly, and that will interface with the Blue Ribbon panel as well.
Okay, all right,
Okay.
thank you, thank you.
Yeah, before we get to Representative Nuccio, I just wanted to follow up and just make a quick comment. Because something that I noticed is there was not much parity on the parent cabinet in terms of gender.
Right.
And there was not much Hispanic representation, given the amount of Hispanic population that we've gained in the state over the last decade or decade plus. So just want to make sure that we're looking out for that. And I understand you don't pick them, but there should be some way to encourage a little bit of a change there, because that is a stark difference in terms of gender, at least.
Mm-hmm.
But
Yeah.
I digress, and I'll move on to Rep. Nuccio.
I would agree with you, Rep. Felipe, that is not reflective of the population of the state at all. I would like to know this here, there's $250,000 appropriated in this budget for the funding for parent cabinet with really not any real detail on what that is. Can you tell us what that money is for?
Sure. There is a staff person who would, organize and bring together the cabinet, set agendas. Again, the parents really guide it. So they work with the parents to develop that, and it's statewide, and also assure the connection with parent ambassadors, which go through the Children's Collective. There are 35 of those across the state with parent ambassadors who then work with the parent cabinet. So the staff person, and then the parents receive stipends for their time, and their 12 parents. And what we find is that a lot of folks sit at meeting tables, and most of them are being paid, but parents don't get compensated for their time. And they're often paying for childcare and transportation, et cetera, to participate. So there's that. Also, members get technology support so that they can be on the state system to receive feedback and input. So that is the cost of the parent cabinet. And we actually think it's really important to name this in statute as an agency, to have parents who are part of our governance structure and give us feedback monthly. Just this month, I went to the cabinet because we're getting complaints from parents that they can't get into their childcare center anymore because they're just taking the kids at the door. And we could get feedback from the parent cabinet about the policies we should be considering and guidance to programs to allow parents more access. And we're hearing about birth to 3 providers being denied access to programs. And a lot of that's coming from the parent cabinet. Really, it's been super important. And during the pandemic, they really helped us as well.
What is the stipend for that? And are they actually meeting, or are they doing it via Zoom or hybrid?
We are doing most of it. They get a $25 an hour stipend for their responsibilities.
We are doing most of, how are they meeting?
They meet mostly on Zoom. Elena, I don't know
Yep.
if you want to clarify
Sure,
that.
we
I've been
have-
to a couple in-person meetings, but I think it's mostly Zoom.
Yeah, so we've been moving a little bit more towards in-person lately, but throughout the pandemic, now we still meet monthly via Zoom. And then we also have subcommittees that meet monthly as well. And so there are multiple opportunities throughout the month for the parent cabinet members to engage with us at the OEC. And then also part of their role is to be out in their communities doing outreach to other partners, to other parent leaders, going to present at community meetings, listening to feedback from from the community and bringing that back. So those are also many times happening in person in their communities.
And this is a new expense for this year, correct?
Yes.
All right, thank you very much.
If I may, Representative Felipe, I just wanted to just lend my voice to this, that I really congratulate the department for putting and advocating for this cabinet. We've heard throughout K through 12 that we need more parental involvement in our schools, and there's nowhere better than to begin in our early childcare, to involve the parents as much, to hear their concerns, what's going on. So I think for this small amount of money that we're getting such a great investment in return to the department. So I'm very favorable for the cabinet. Thank you.
Thank you, Representative.
If I may also, I'm sorry, it's quicker to do this than to press the button. Thank you so much for the presentation. I just, as far as the parent cabinet, I also think it's really important to have parent voice. So I like this idea very much. I do think there could be some, a bit of reshuffling around the demographics to be a bit more reflective. But as far as the 68 hours that the parents contribute through work, is that a collective, or how is that captured, the 68 hours? Is that from the collective group?
Elena, do you want to?
Right. So we do have a monthly reporting form. So each of the members are asked to report monthly their activities that they're doing. And we've laid out a framework and a guideline for them so that they know which kind of roles or steps to take during the month. And so each month we get activity report forms, and we link those activities and those hours to the stipend.
Every month. Okay. All right.
Yes.
Thank you so much. Thank you. Good to see you, Commissioner.
Okay, should I go on, Representative?
Yes.
Then I was asked about specifics on the increase in school readiness and child daycare, full day preschool rates. And this shows that we're moving from 89.24 per child to 10,500 per child, a 17.6% increase. And it also shows you how many children are being served this way. This is actually our best strategy for helping those families that don't qualify for Care for Kids. In these programs, 60% of the children need to live below 75% of the state median income, and 40% can be above that. Just so I know that's been a concern of this committee. The reason that the next question was provide a breakdown of what is funded under the early care and education line. That's child daycare, school readiness in priority and competitive districts, and then school readiness quality enhancement. And then provide a breakdown of child care deserts. We provided some of this for the committee. I think it could be just so there were a lot of questions about this, so I'm going to try to share another screen to show you how this has been. We have what's called a desert index for the state. Mm-hmm. And you have low deserts, medium deserts, and high deserts. Mm-hmm. And so we have every town listed by its desert status, whether it's low, medium, or high. And we're really grateful to the demographic work done by UConn on this. So I could, I know Representative Felipe, you're from Bridgeport. You have a high childcare desert, meaning that even though you're a densely populated city, you don't have enough childcare for the number of children there. So we have this, and we've sent it to you with every town in the state. We've never included this before in our planning. And I think, Senator Austin asked a lot about Eastern Connecticut. Sometimes regions like that in the state have been left behind of prioritization because we've only looked at social vulnerability index. We haven't added in deserts. And this is really a national move. States and the country are trying to figure out, how do we deal with these rural places that don't have enough childcare, but maybe don't hit the population and income thresholds. And so by combining this with what we call social vulnerability index, all of our new ways that we're giving out funding, the facility and the new early childhood spaces for infants and toddlers are using this strategy, the combination of high need plus desert, to target the funds differently than we have in the past. And we've been asked to present about this nationally because, as I said, this is a national challenge that UConn helped us figure out, and frankly, the pandemic helped us figure out, because we were trying to figure out how to target dollars, and at the same time, so was CDC trying to figure out how to focus what they were doing. And the social vulnerability index comes from the CDC, but it's broken down by census tract.
Okay.
So,
I know Madam Chair has her hand up, but really quick before we go there. And by your estimation, do you think that counting it this way will help in terms of figuring out where places are actually missing childcare altogether? Because you look at a desert in terms of Eastern Connecticut, right, where they're not densely populated, their index is a little bit different than ours. We have childcare, it's just not quite enough for who we have.
exactly.
Because recognizing from many anecdotes I've taken from listening to Senator Austin over the past few years, it seems like they don't have anything, where we have something, but we're still rated in the same level as they are. So,
well, yeah, but actually, if you go by score, Norwich is in the top 7, but it's not in the top 3. I think, you've got to put together population and high need and how much is available. And so it's complicated. And certainly Norwich and New London are areas with high need, as Senator Austin's an incredible advocate for her region. But Bridgeport is dealing with a significant desert as well. It's like, you think, oh, you're in a city, there are a lot of grocery stores. Well, guess what? There aren't grocery stores a lot of times where people need them. So it doesn't always make intuitive sense, which is why we went to the data. And that's how we're using that data to guide us. Senator Walker, I'm looking at you. New Haven has childcare desert too. And you'd think, oh, New Haven, Stamford, some of our growing cities. But they are, Stamford is in level 2, so they don't have as much of a desert as Bridgeport and New Haven, but they're still deserts in densely populated cities. So I just think it's important that we have to look at both things together.
Yeah, no, we have watering holes with significantly more thirst, so it makes sense.
Exactly.
Walker.
Thank you, Mr. Chair. I was going to point out that there are 20, because I looked through this, and there are 20 cities that are listed, and all the big cities are listed. And then if you think about our conversations with the State Department of Ed and the chronic absenteeism, all the big cities are part of that conversation. So somehow, somewhere, we got to stop and figure out how to resolve this, because these are the kids that don't get the childcare, and then they don't get the education, and then they end up in other potholes. And so to me, it's saying that we can see where we need to go and what we need to do, but we don't do it. So when I looked through this, I was very appreciative for you to share this with us, because it is critical. But when you put all these things in line, we are very clearly, we see the need, but then we just turn the page and go on. So that to me is it's an egregious issue, and it's not just OEC, it's SDE, and it's DCF and all these others. We know where the problems are in the cities. We know who's got them, and we know the communities, but we're not doing anything. So identification is one thing, but actually doing something is another.
Representative Walker, I believe we have to do much more. So I agree with you there, but I would disagree that we're not doing anything, because we're literally shifting where we're assigning childcare spaces and who's going to get the facility funds to build spaces based on the desert and the income levels. So
That's what
really
you
are trying to shift the way we fund increased capacity to line up with desert.
Okay, well, I'm gonna go through and look at the different regions. I didn't get
Sure.
that much detail, but thank you for that information. Thank you.
Mhm.
Thank you. Any other questions on the desert index that we just were shared with?
Just, if I may just say, to allay some of the fears of Representative Walker, we are looking, and I thank the commissioner for her work in getting us this demographic. We are putting in a new early childcare facility in Groton, and that will be right in the vicinity of where we have one of the deserts. So there is work going on and looking at where we need to shift some of the capacity building. So I just wanted to add that, to add a little point of optimism here.
Thank you.
And Representative Filippi, just looking at the time, we did
Mhm.
provide the demographic information about childcare providers to committee members. Rather than go through that, I think it's really important that we make some time to get to birth to 3 and home visiting and some of the questions that came to us related to that, and then we can come back to this. Is that?
I would agree.
Okay. Birth to 3 has a reduction of $5 million in the gap payment for fiscal year 25. This is again representative of, there were temporary funds because Birth to 3 was having a super hard time during the pandemic recruiting staff and serving families. And so this legislature and the governor added increased money for gap, which carries in through 24. And then, as I said in the first time, we are doing a cost analysis to look at how Medicaid and the state's rates can combine to fix this. And so that is something that's happening now, but I'm happy to stop here and take birth to 3 questions, because I know that's an important issue for many of your members.
Yeah, are there any questions that folks have?
I got a question. Yeah, and I missed part of your presentation, Commissioner, but we talked about using some of the dollars to use for Birth 3 program as opposed to our early childhood program. Can you speak a little bit on why we're doing that and how that helps communities seats in Birth to 3 and don't have the capacity or the resources to do it, but now that we're making this change and opening up opportunities to go from just early childhood to Birth 3 programs. Can you speak to a little, just briefly about that?
Oh, I know what you mean. You mean the change we made after this committee had a workforce, and we made a change to allow families to stay in Birth to 3 if they have spring birthdays, and then they maintain, rather than have to shift to the public schools, they can stay in Birth to 3 till September when the school year starts.
Yeah, I think, remember we were talking about this, there are kids that are on Birth 3 and there's a year gap sometimes after they were getting services in Birth to 3, but they don't start school till they're 5 years old. And sometimes they get dropped out the system because of that, which is 3 years of getting what they need. And then all of a sudden they're out of a program.
I know what you're talking about now. Yeah, we talked in the Education Committee for members of Approps who might not be on education about proposals to look at Birth to 3 potentially as a Birth to 5 system, because what happens often is families are in Birth to 3 and then they go to their transition conference to enter the public school preschool, and they may not get the services that they were getting in Birth to 3, and they're not home-based and family-based and center-based. They tend to have to come into the public schools, and then often the schools only offer, say, 4 hours a week. So they have to leave daycare on Tuesday and Thursday to go get those special services where Birth to 3 had been providing those services on site. And so for some families, I've talked to parents who've had to leave their job so that they could get their child to 3 and 4-year-old intervention services. And so there's a conversation going on in education about how to either you know, improve what happens at the transition so kids keep more of the services and it's more family friendly, or take a look at the whole system. And I was speaking about one small fix, you know, thanks to Representative McCarty, had a bill to help us have kids stay on birth to 3 longer until they hit public preschool.
Right.
That change happened and that cost is assumed in this budget in an ongoing way.
Okay, thank you.
Yep.
I have no more questions. Any other questions?
Are we talking about birth to 3 and home visiting?
Birth to 3 right now, and then we can shift to home visiting.
Well, I was just reading your response on birth to 3 and home visiting. And one thing I noticed is that OEC takes a more active approach, it seems, with home visiting than I don't see them in part of the evaluation in them, but it says together OEC program liaisons, contractors and subcontractors, representatives review and analyze. So I don't understand why the emphasis for OEC is on home visiting as opposed to both entities.
Thank you for that question. It gives us a chance to explain. First of all, home visiting has been our first program that moved to active contract management with a rate card where programs are differentially reimbursed based on their performance. So that was, you know, we started as an agency in home visiting. Birth to 3 is a much larger program than home visiting. It serves about 15,000 children, and I'll ask Nicole to come off camera and correct me if I'm way off on that, but I think last I checked. And there are very, very specific rules around birth to 3 that aren't in place about home visiting. Home visiting, you know, from the feds to us, there's certainly rules, but you can see from like the difference between, say, parents as teachers and Child First, totally different programs. So we felt we needed to get a handle on expectations and requirements and what our state was looking for there. Birth to 3 has very significant federal rules around children having individualized family service plans, and the contractors have to meet the goals and requirements of those, and they have to answer to families and the system regularly on that. So we have to monitor programs. But I'll ask Nicole to just come off camera and talk about
how many kids do we serve in home visiting right now?
I'll have Ashley answer. I believe it's under 3,000. It's like 2,800. But Nicole, how many in birth to 3 are we serving?
We serve around 11,000 in any fiscal or calendar year. And that's the unduplicated count. So children might exit and then re-enter the birth to 3 system. On any given day, we're supporting about 7,000 children who have an active individualized family service plan.
In birth to 3? In birth to 3.
I was a little high. Okay. And Ashley, do you want to give the data about how many children we're serving in home visiting right now?
Sure, we're serving just over 2,000 children in home visiting through fiscal year 22, and we are on track to serve that plus more in fiscal year 23.
And how much money are we budgeting for birth to 3, and how much money are we budgeting for home visiting?
I will ask Sarah to give the exact number for birth to 3 and home visiting.
Okay, Sarah.
Hi, sorry. I'm just pulling up a quick.
And just while she pulls that up, Representative, birth to 3 is both the funds in that you see, and then there's also Medicaid reimbursement.
Right. There's about, I think, $3 million in maintenance of effort from us, and so that how much is federal dollars in that?
Yeah. Okay, Sarah, do you have the number now?
Well, our birth to 3 appropriation for this for fiscal year 23 was 31 million, and our appropriation for McPhee or NFN, which is home visiting, was 13 million.
Okay, thank you. Thanks.
Thanks, Sarah. Thanks, Ashley and Nicole.
Next. Okay.
Okay. So that's that question. Any other questions about birth to 3 or home visiting?
I don't see any.
Okay.
Madam Commissioner.
Yep.
Is Smart Start what is Smart Start?
So Smart Start is a program where we partner with local municipalities and
Okay.
public schools. So
Okay.
you remember, we
So
pay.
it's not like birth to 3 or home visiting.
No, Smart Start is a early childhood program. It's public school, preschool, where OEC provides $75,000 in funding and the public school provides the rest to support early childhood classrooms in public schools. So this is a very small part of our early childhood funding. I think it's a little over $3 million, but it leverages, about $100,000 per classroom at least from school districts. So it's a way that the state pays part. So when we're paying, for example, a school readiness slot, we're going to pay more than $10,000 a kid. But with Smart Start, the state pays $75,000 for up to 20 children. So it's a way to just leverage where the state has a role. And if the city says, okay, we want to participate, we match that. So we have way more asks than we do funding from districts. But that's what that is.
Okay. All right. Thank you.
Okay. Then these were questions about quality assurance, and we have both the licensing and we've launched a program called Elevate, where we are entering, all programs can enter Elevate and get support to improve quality and give parents information about our programs, NAYC, NAFCC, which is Family Child Care, and Head Start approved. We will give parents that information so they'll know which programs meet that standard. And we're developing an in-between step between safe licensed care and accredited. That is a level 2 that parents will ultimately know. And we've been working with NAEYC on this and piloting some programs that want to take that step toward accreditation and have an approved program plan, which would be level 2. So we now just have licensed or accredited, and we really believe programs need that middle step and they need more support. A lot of states do their quality assurance by going in classrooms and rating them, and that's super expensive. So we're taking the money, we're using a national standard and taking the money, and for quality assurance, it comes from the feds, and using that to provide supports to programs versus spend our money on IT systems and rankings of classrooms and helping programs improve themselves. We also oversee camps that are licensed. So these are the different groups we license, and then there's a very long explanation of what happens with licensing, and we can answer any of your questions about that, but that is really our regulatory component. It's almost half of the staff at OEC. We have one unannounced visit for every licensed program in the state, and then we have follow-ups if there are corrective actions needed, and we often work with DCF when we find cases of abuse or neglect, which isn't often, thankfully, but one is too many. And so we have a very collaborative relationship with DCF when there are corrective action plans or investigations going on. And then
before we move on,
yep,
I saw
sure.
Rep. Paris's hand go up.
Sure. Representative Paris.
Thank you, Mr. Chair. Commissioner Bai, just a quick question on the licensing piece. Some of the youth camp licensing, would that include organizations like police activities leagues?
Yes, if they meet certain standards. I'm going to ask Liz, this is a very technical answer, so I'm going to ask Liz Proietti, who is our licensing director, to explain. It has to do with the kinds of activities offered, the ages, and whether or not it's a municipal camp or not. So Liz?
Right, so activities like the Police Activities League might conduct certain activities according to
our current regulations would be exempt from licensure. If it was purely a mentoring program, if it was purely an athletic activity, if it was purely they did purely drama or purely, a library program. But when they start to do multiple activities for children under the age of 13, that's when the licensing requirement would be applicable.
Thank you, Liz.
Thank you.
Okay. And then I believe it was Representative Walker had questions about Child First. And we have 7 agencies implementing that. And we did do some calculations about the cost per visit that we will get to the committee. We didn't have them in time to run them through the whole process, but we could share those with you if you'd like. But this shows you the funding amount. Part of the reason that Child First is a little more expensive is their sort of affiliate fees and then their national fees for every program that add on. But these are the programs. There's $2 million, and you'll see their staff and whether they're at whether they're fully staffed or not.
Okay.
So
I
would
can
you
read.
like
I
me
can
to?
read. No, I can read. I can read. I can read that. That's okay. That's fine. I'll read. Don't worry
Okay,
about
we'll send that along to you. I'll just ask Maggie to get that to the committee. So it's much more expensive per child, but it's a more intensive program for the highest end children.
it. Okay.
So,
That's
okay.
good. Thank you.
And then we talked about some of that. And so those were the questions that the committee had submitted. And I hope you'll find my team, I think, did a great job putting together the answers to all of your questions. And if there are follow-up questions or other items you want information about, Senator McCrory and Representative Felipe, we are happy to provide those.
Okay. Well, any additional questions for anybody in the committee? I know Representative Nuccio has raised her hand, but I don't know if anybody had any questions outside of what we were just presented. Rep. Nuccio.
Thank you very much, Representative Felipe. Thank you. So I had sent over some questions that I'm asking all of the areas, and I'd like to kind of just review those.
Sure, I've got those. Yep.
Okay,
Sure,
so looks like you guys are actually funded for about 98 of the 118 positions you have listed, correct?
I believe that's correct. I'll ask Sarah to confirm that because she did some of that math for us.
Yes, that's correct.
Yeah.
Okay. Do you happen to know when you have the 118 in the budget, is the fringe also calculated for 118? Or is the fringe calculated off of your funded 80 or 98, I should say?
But the fringe is calculated and paid for at OSC. So
no, I know, but it's all one FTE, right? So what's in your budget? If you have, is your budget reflective then of just the salaries for 98 people?
Correct.
Okay, and of those 18 opens, what did you have for vacancies throughout the last year?
I think it was relatively the same amount that we have now because we had some normal attrition and some moving around within the agency and some recoding to realign with funding strings. So we're pretty much about even with last year.
So you're around 18 last year also. And do you have those 18 in the budget full year, full-time starting July 1st?
Yes.
Okay, and do you know how many opens you were able to fill last year?
Well, since July, we've added net 7 positions. I can get you how many we hired last year. We are doing our level best. We plan to hire 18 full-time positions in this fiscal year. And it just takes time to get the hires in place, but we certainly, my team would tell you, we've been working super hard to get positions through. You all added some fiscal and grants and contracts positions last year, and we've been able to fill some of those, but we still have some fiscal supervisor positions open that are critical for us to fill because we're managing significantly more funds and significantly more contracts. So we're working closely with DAS to get those hires in place.
Okay, the next question I had is, did you have any lapse dollars as of 6/30 last year? And are you projecting any for this year? And if so, what are they?
Yes, we did have lapses last year, and in our document to you, we referred to a document that's in the Office of the State Comptroller.
Yeah, everybody kind of sent me that instead of just sending me their lapse dollars.
Well, certainly the area where we will lapse this year is in the Early Childhood Education Fund because of the enrollment challenges that childcare programs are facing, the school readiness and the child daycare programs. We often lapse there because you can never get to 100% enrollment. And then, but for the most part, we use our funds. That's a line item that traditionally changes. The other thing that is very hard is birth to 3 can be really hard to predict. So those of you who've been on this committee a long time know we will sometimes come to the FAC to move funds in birth to 3 because that's an entitlement. So whatever is needed is needed. So sometimes it's lower, sometimes it's higher, but that is a line item that's very variable.
Right. Do you have any idea what you're thinking the lapse is going to be for early childhood education?
A lot of that depends on where this budget ends up, and there are other considerations going on. Like, for example, some of those funds are going to new infant toddler spaces, and it will depend how many classrooms that are awarded need funding for construction as well as the funding for the spaces. So we just don't know right now, but it will be millions. It will be more than $2 million, certainly.
And do you happen to know the number for last year?
I can ask Sarah for that. Do you know what we lapsed in our last year's budget in ECE?
I believe it was somewhere around 10 million.
10 million. Okay, if you can get me, rather than just giving me the link to that report, because that report is huge and digging through that to find each areas, if you could just provide what your lapses were for last year and by breakdown, and then what you're projecting for this year for lapses, I would appreciate that.
Yep. And Representative, just know also we do provide our CFSR to OPM, which is our monthly sort of projections, and OFA also has access to that. Isn't that correct, Maggie? And at least when I was in your chair there, OFA was able to get us stuff as well. And we will get you the
Yes,
information.
we share that with OFA on a monthly when we get it. We just shared it with OFA.
Okay.
Okay. And now, do you guys carry forward any of your laps, or does it?
Sometimes it depends on what it is, what we carry forward.
Okay. I think that is all that I have for right now. Thank you.
Okay, thank you. We'll get you that info.
I appreciate that. Thank you.
All right, I think Senator McCrory, did you have a question before we get to Rep. McCarthy? Okay, Rep. McCarthy.
Nope, I'm all set.
Thank you. Mine is generally a comment and then probably a follow-up with the commissioner. Just first want to thank you for the very detailed answers. I don't know how you did all that in that short amount of time.
My team, it wasn't I.
No, but I mean, it's quite impressive, everything that we received. But yesterday we had a public health meeting, and I'm not sure if the department is aware, and I'm thinking for the what you call the home visiting rate card and the incentive grants. And I'm wondering if you have any knowledge of this cytomegalovirus that we talked about yesterday, and whether or not you'd be open, and I'll call you, we'll follow up with a discussion, but I'm thinking if we could get that information out more to our child care centers early on, because the virus is transmitted greatly with early toddlers, and then it can be transmitted to the fetus from the mother who might be there or going on. So I'm just thinking ahead, because it's the leading viral cause of birth defects. And just,
Wow.
I'll follow up with you, but I think it may be an area that we want to look at going forward to see how we could educate our early child care givers and the families so that we could help prevent some of that going forward in the future. Just
Yes.
sorry to
Nope.
I
No,
thought
I
I
think
just
it's
had you
important.
here,
Yep.
so.
We will look at that, and we'll talk with your office about ways that we can spread that. We are lucky to have a system where we can send messages to every licensed program in the state, which is super helpful. It reaches 50,000 children at least.
That would be wonderful. Thank you so much, Commissioner.
Mhm.
Can I ask one more question?
Of course.
Beth, did you lapse any money this year?
Well, we haven't ended yet.
Okay.
You mean
Did
last year?
You lapsed last year? How much did you
Yes.
lapse last year?
Well, Sarah said that in the ECE line, we lapsed $10 million.
What do you from, is it just because of,
It was because with the pandemic, there was much lower enrollment in the state funded programs and some of the staffing and workforce issues where even if folks had a classroom to open, they couldn't find the staff. This is like what I was talking about in terms of access for families, that, you know, the funding model isn't working for programs. And there was this really interesting statistic from Bank of America. I'll send it to you. I'll send the report to you all, but parents are spending much less on childcare. I think 7% less, because during the pandemic, they figured out these sort of patchwork situations when the childcare is closed, and they haven't made their way back to the programs yet, either because of expense or convenience. And so we're really working with our school readiness providers to help with recruitment. But, you know, as they have fewer children, then they don't get paid by us. And then that leaves us with funding left at the end of the year if there are fewer kids served.
so if you, what are you applying the 10 million to this year, since you lapsed 10 million?
Well, we didn't carry it forward. It just went to the general fund. You know, the funding. It's not like we carried it forward to this
You
year.
didn't carry it forward?
No.
Yeah, can I follow up with that?
Sure.
So yeah,
Sure.
that was a good. That's interesting, that report you got.
Yeah.
But if we know that the reason you lapsed 10 million is because the parents were not sending their children back, and things have started to change a little bit, and they are going to start sending
They
their
are
children.
changing. Yeah.
Right. So how do you account for that in this budget going forward, considering that we know that they're coming back, but you probably budgeted off last year's budget?
That's a really good question. No, Senator McCrory, we did not want to lose childcare capacity because
Right.
we knew these were temporary situations. So we will probably lapse significant dollars again this year, but not as much. I just was talking to the New Britain lead today, and they
Right.
find they're adding 12 kids a month right now. So slowly kids are coming back. And you know,
Let me just
takes
ask you
time.
real quickly, in the middle. So I would ask that you, like, in the middle of the year, like halfway through your year, and you see that some communities, like let's say New Britain, the numbers are rolling. And in some communities, they're not rolling as much. And in some communities, there's a need.
Exactly.
Do you have the ability to pivot midstream and support the areas of the communities that have the need and that have the need? You know what I'm saying?
Yeah.
Even if you budget for them at the beginning, do you
Yeah.
have that?
We are in the process of that now, Senator McCrory. We're reassigning spaces. Like we have communities with waiting lists and classrooms that could open, but they only are assigned a certain number of spaces. So we have sent a survey out to all programs, all cities who are in school readiness, to tell us if they can take more kids so that we can reassign some kiddos. and spend those dollars because we know their kids not getting preschool. And in fact, this week, I don't know if Kim or Deb is on the line, but we opened a full classroom in East Haven, I think, that said, hey, we can do this if you can give us some spaces, and we knew we had funds. But Kim, where was that classroom that opened and
It was
your
East
team really
Haven.
moved quickly? It was East Haven?
It was East Haven, yep.
Yeah, so, but I don't want to cut you off, but I have to run.
Yeah,
so that's why it's so important to put those resources in to bring the rates up so we can pay people so you'll have staff in the buildings.
Exactly. Yeah.
Right. So the argument, for the 14 million, 50 million is because when these people, these kids come back, we need the staff there to pay them, right? I mean,
exactly. That's why, that's why the increase in the, the 17% increase in the rates we pay for school readiness and child daycare are essential, and why the governor put those funds in the budget.
Okay,
and you all really helped this year because of the 30 million you assigned last year to this year and next year. And then the third year, the governor makes it permanent. So programs aren't looking at temporary fixes. They say, okay, this is in the budget. Now I can give my staff a raise.
Thank you. I'm done.
Thank you.
All right. I don't see any other questions. Oh, Rep. McCarty.
I'm sorry, it's just very, very quick. I was glad to see the Even Start program left in the budget. I know it's a small program, but the results are really amazing.
Fabulous. Yeah.
And are there Even Start I know we have one here locally, but how many are there in the state?
There are only a few. I would have to ask Maggie. I think she keeps track of that for me. There are not many.
I think Ashley knows that as well, but it's isn't it Middletown, New London, and Torrington? Am I right, Ashley?
You're correct. There's only 3 in the state.
But it is a real 2-gen approach. It's a wonderful program.
Yeah. Well, thank you for supporting it. Thank you.
Thank you. I'm sorry, I'm leaving the cookie.
That's okay. Any more? I'll take it from here, Felipe. I'm gonna let you take it because I have to run to my next meeting. Any other questions?
Yeah, where do we get Felipe's cookie?
Yeah.
Well, you want to come down to higher ed? I have a box full of them because people, I got them sent to me. And I'm trying not to eat them all myself.
Your office.
All right. Well, Commissioner, I want to thank you again for your testimony, your reports, your information, and we look forward to working with you and again making this a very productive session. Thank you.
Thank you, and bye, Sukeen. Great to see you. I miss you, and thanks to you and Maggie for getting all that information together and making sure the members had it. So we'll see you soon. Feel free to ask any other questions you want.
Thank
you. Yep.
Felipe, can you take a second off your cookie and finish this last one up? I have to run to another meeting.
Oh, absolutely.
I appreciate you, brother. Thank you.
Cookie is gone.
All right, we've got the state librarian and her team. They're in and ready to go.
Awesome.
Good afternoon, everyone.
We're just going to do what we've been doing with everybody today, which is a quick overview, and then we'll get right into questions if anybody has them.
Sounds great. Right. Good afternoon, everybody. We're here from the State Library, and in the budget this year is a proposed increase to the Connecticut Digital Library line, which supports a variety of electronic resources that we use to support access to information and resources to students, members of the public across the state. And this essentially is an inflation increase to allow us to continue maintaining databases that we currently provide to those communities. And we would be happy to answer any questions you have about this or any other line.
All right. Any questions from the committee?
Yes. Sorry, couldn't get my hand up.
No, I figured the staff questions were coming.
Actually, I don't think they sent back my request for questions for the staffing and all of that. So
yes, they did.
Did they?
Yeah.
I'm looking for it, and I did not.
Went out to subcommittee members today.
Oh, it went out today. I may not have seen it in the email then. Let me search quickly for that then. You can, if anybody else has any questions, please feel free. I will see if I can find this.
Yeah. I personally do not. I don't know if Rep. McCarty has any questions as ranking member. But
I just would comment that I think the state library, for the amount of funding, does a tremendous job with the work that they've been doing over the years. So I don't think this is the right moment, but I was going to ask about the Dolly Parton reading program, but I think we can follow up on that at some other point. You were going to look into where and I should have mentioned it earlier when we had OEC, but just wondered if you had any follow-up on that.
Nothing from our side. I did speak with somebody from OCE last week about their response, and so we're continuing to look into options on that.
yeah, well, for any members who weren't at the hearing,
Just found it. Thank you.
can we go back over just a quick, and I know I asked the same exact question, but just for people who didn't see it last time, quick overview on what the digital library does for us.
Absolutely. So the digital library is one of our appropriations we've had for a little over 10 years. And this supports a variety of different resources that are for students, for members of the public across the state. And so this is ebooks that we provide, typically back catalog, titles, classics, things that you might not necessarily find on the bestseller list at your public library, but something that we can provide. And one of the things that we particularly are trying to focus on with that is supporting our school libraries. They are often significantly underfunded, and so we are trying to provide those resources to school libraries and continue to expand that program. It also supports statewide lending, so interlibrary loan between libraries. The back end catalog that we use to provide those services, ways the libraries communicate to each other about what is available, as well as about 38 databases that we provide to public libraries, anyone who has a library card, on workforce development, professional education, a number of other resources, particularly for public and academic libraries. And so those are essentially what we are continuing to provide and looking to see an increase in that. The reason that we're asking for the inflation increase is essentially library materials increase on average 7 to 15% every year. That's simply to maintain existing resources. The cost from vendors go up. And so if we receive, for example, a flat budget, that is actually a cut for us, and we have to look at what we can reduce in our in what we fund with our appropriations because of those vendor increases. So the cost that you're seeing in this case is to continue providing some of the resources that we provide through the Research It database list.
Awesome.
These are nope. Go right ahead.
I think Representative Nuccio got her material, so I think she's ready.
I did. Thank you for asking questions. I appreciate that. So thank you for your responses back to the questions. I noticed in here that you have 8 full-time positions that are not filled, but you noted in here that they are not all starting July 1st, but are staggered start dates.
Yes, so these are some positions that we are in the process of refilling. All of them have been approved for refill, and we're in various stages of the process. So a couple have just recently finished interviews and will hopefully be starting in the very near future. A few of them may take a little bit longer, but that's why it's a staggered start date.
Okay, but you have that planned in your budget as a staggered start date and not all 7/1.
Yes, that's correct.
You are the first state agency to say that. So if I had a gold star, I would be giving it to you. Yes.
Fantastic.
Okay.
Well, it's thank you to Jay and DAS for helping us do that. So
I appreciate, I can't tell you how much I appreciate that. The next question that I had is, you mentioned that you had lapses in here. Again, thank you for actually giving the numbers in that the lapse was in the digital library of about $130,000. Was that accrued and then paid for in the next year? Because it said that carry forward was used to make the payment upon deliverable. So
Yes.
did you have it ordered? So it was basically, everybody seems to call it different, accrued, encumbered, or something.
Yes, it was, unfortunately, it was some equipment that we needed to purchase to continue supporting the services in the digital library. And unfortunately, due to back order, we weren't able to receive it in last fiscal year. We carried over the funds and received it fairly shortly after the start of this new fiscal year. And that has already been taken care of at this point.
Okay, and are you expecting any lapses so far, for projecting any lapses for this year?
Not in this line or any others. We tend to be, as our budget is very thin, so we tend to very rarely have carryovers or lapses.
Okay, and that was the only thing that you lapsed in for last year?
Correct.
Okay, and then I know when we had originally talked, you had mentioned something about asking for an increase than what the governor allocated for the digital library to get it back up toward the $2 million number. But then you have in here the increased cost of the digital library contracts. Is that that's just what you were talking about to reflect the increase in cost of materials?
Yes. So what the governor has put in the proposed budget is the inflation increase, but we would always be happy to accept additional funds. And so there's a couple of examples in those documents.
I like how you put that. Okay, and also I had something written down about the library for the blind. Is this an adequate amount in here for the library for the blind? It's kind of staying stagnant at that $100,000. Do we still feel good about
So that is actually a new appropriation. The $100,000 was first put into our budget last fiscal year. And so what we have been doing in this first year is using it to purchase software and equipment, renovating some of our facilities, working with staff in those areas. And we anticipate there will probably be several years at which that will be adequate funding. This is a hybrid program that is primarily funded through federal dollars. And so the state contribution has actually always been fairly low. But we are happy to use those funds to increase in some of those areas. One of the things that we're currently working on is we have been invited to go into the next round of proposals for a federal grant, which would allow us to educate library and museum staff members about how to provide services for members of the blind and print disabled community. If we are able to receive that grant, we'll move forward with those funds. But if we don't, or even if we do, and there are additional funds, that could be a program we could continue to support with that appropriation as well.
Okay. I think that answers all of my questions. Representative Flappy, thank you very much for humoring me and coming up with questions until I could get my papers in front of me. I appreciate it.
Yeah, you got it. Any other questions from the committee? Seeing none, I think that's it. And as I said earlier, I just want to reiterate, the less questions we have, the better we think something is working most of the time. So
wonderful. I appreciate all the kind words today. Thank you.
Absolutely. Thank you so much. Madam Administrator, does that take us out?
That takes us out, sir.
Awesome. Well, I want to thank everybody who tuned in for however long you guys had the time. We know everybody has a lot going on, but this is a very important subcommittee. It seems to be going strong. There wasn't a lack of questions earlier, and I know we have a lot of work ahead of us, so I look forward to working with you all further. Thank you, Madam Administrator. I hope everybody has a